I bumped my elbow. I had an unnatural amount of bleeding and bruising in that elbow. So about 3 days later, I took myself off to an emerge department. You have leukemia of some sort or some kind of blood cancer. Your bone marrow's not working properly. And that's when the bottom fell out of our world.
I started feeling a great deal of back pain in my lower back. I suspected that it was simply due to a sports injury. I was diagnosed with multiple myeloma, cancer of the bone marrow.
We were planning the future. So we were at an age where we were planning an exit out of work and an exit into entry into retirement and charting out some hopes and dreams that we had been waiting to do. They told him he had acute myeloid leukemia, and it just took us out, took our knees right out from under us.
Getting that kind of diagnosis is devastating. I chose not to tell my family at all. That was the best gift I could give them, was another 2 or 3 days of normality.
When you hear someone you love has been diagnosed with leukemia, it's heartbreaking.
It's very much a situation I felt I'm thrust into it. There's not really a lot of choice in the matter. The autologous stem cell transplant was the most obvious solution for me.
The only option I could consider if I wanted to live beyond maybe about 18 months was a bone marrow transplant.
In my view, preparing for, undergoing, and carrying on after a stem cell transplant is just as much of a mental battle as it is a physical one.
When you're a caregiver of a patient with an illness that is so frightening and difficult, that the caregiver needs to be cared for. You cannot rescue someone if you are jeopardizing yourself.
When we walked up to the building and it's, you know, the great big cancer center, we both just kind of stopped and kind of looked at each other, and it was, okay, this is it, this is making it real.
Got in the car, and I remember looking up at the window, and he was waving. I'll never forget that. I'll never forget leaving him in that hospital.
For my kind of cancer, I needed to get a donor. You are poked, prodded, and tested, every system in your body. You are assessed for your mental health until you're admitted for transplant. And from that point on, you are a patient of the transplant service for life.
Indeed, the idea of the chemotherapy is to get rid of or kill the myeloma protein that is present in my blood system.
And we took really nice photographs of ourselves on our motorcycles, and we put them on the door to say, hey, this is a man and a woman who are here. And I say we because I went through that with them. I'm not the patient, but I feel like I am in some ways.
You know, after all of that, the transplant itself, it's almost an afterthought. Because after all the workup, all the prep work, all the testing, it's an infusion. And you just kind of lie there in bed and you look up at this bag and you think, is this what it was all about? But it worked, because here I am 11 years later.
The first 100 days after the stem cell transplant is and rightly so, is very important time for a patient. There was no sign of my disease in that first 100 days. I'm happy to say that I have remained disease-free, and I've surpassed even my medical team's prediction of when a relapse might occur.
All of a sudden, your normal transitions to a new normal. I no longer have cancer. I deal with the effects of the transplant. So I have graft versus host disease, where my body is trying to reject the transplant.
The CBMTG patient and caregiver group did not exist when I first was diagnosed and was undergoing my stem cell transplant. Had it existed and had I been aware of it at the same time, given me that peer-to-peer support, now that I know how valuable it is connecting with other patients and hearing their stories. It's a tremendous support and inspiration.
And Andrew is still struggling with his graft versus host disease. It does not stop him. It does not stop us from moving forward on that dream. And it used to drive him crazy when they'd say, you have to get used to the new you. And you have to just say, okay, I'm a different person than I was before, but my dreams haven't changed.
I'm here 11 years later. My kids have graduated, they've started their careers, my son's getting married. Life goes on. Life is wonderful because life is still available. And it's worth it. It truly is worth it.